Okay. It's my pleasure to introduce our last speaker of the conference this weekend, Dr. Simon Yu. Dr. Yu practices internal medicine and alternative complementary medicine in St. Louis, Missouri. He's a graduate of Washington University in St. Louis, and he's a master's degree of his research in virology, immunology on influenza virus and cell-mediated immunology. He completed 300 hours of postgraduate medical acupuncture training in Stanford Medical School. Dr. Yu has been studying alternative complementary medicine for the last 20 years, and he's published numerous articles in St. Louis health newspapers on controversial medical topics, and just published the book, Accidental Cure 2010. I just want to say one thing real quick, because as biologic dentists out there, I don't know if you've ever had the question of how did you get involved in biologic dentistry. I just wanted to say this real short. I met Dr. Yu about 16 years ago, and he was the one that, as a medical doctor, taught me about the ill effects of mercury, also taught me about the tooth-body connection. So to say the least, my world was continually, I had a huge paradigm shift. And I am grateful for your mentoring, Simon, and it's just been a wonderful journey for me. But I also want to thank Dr. Yu for his support of this academy, because it's the work that he is doing in his office now that really helps to continue to validate the work that we do as biologic dentists as we treat our patients. So without further ado, Dr. Yu.
Thank you, Mike. Thank you. Thank you for the invitation, and I'd like to make a disclaimer. I do not have any financial interest of a product in my talk or any companies offering grant money for this continuing dental and medical education program. So my topic will be dental and parasite as a missing link for incurables. And subtopic is accidental cure for cancer. So the objective for this lecture to recognize that parasites and dental problems are always overlooked in medical practice, new way of detecting parasite and hidden dental problems by using current technology based on EAD and acupuncture meridian assessment, prevent recurrent parasite infections and parasite-related dental problems, understand that incurable dental medical problems might be parasite-related, and I'll show you some evidence-based case studies connecting the cancer with parasite and hidden dental problems. And you as a biological dentist play an important role for anti-aging medicine. This is a type of, not by dentists, but biological dentists. We'll talk about some of those cases. So 1 out of 2 men and 1 out of 3 women will develop cancer at this current age right now. This is beyond epidemic problem. Some of you already have cancer, or some of your wife or husband or family member have a cancer right now. And this is a pandemic problem in the United States. In 1999, the published medical treatment in East Conflict case over 100,000 deaths, saying become the 4th leading cause of death in the United States. And in year 2000, published in JAMA saying medical care become 3rd leading cause of death in the United States. Those total 225,000 deaths per year from iatrogenic cause constitute the 3rd leading cause of death in the United States after the death from heart disease and cancer. Year 2005, National Vital Statistics talked about cause of death, but they never mentioned about iatrogenic death. And at the same year, Journal of Orthomolecular Medicine published over 783,000 deaths caused by iatrogenic medical care at cost of $280 billion for the #1 leading cause of death in the United States. So medical care itself becomes the leading cause of death in the United States. This is what I call death threat. So Gary Null talks about death by medicine. Carolyn Dean talks about death by modern medicine. Death by drug companies, death by healthcare bureaucracy, death by modern medical doctors, murder by injection by useless millions. And I'm asking you a question. What about murder by dentists? I really feel we get falsely accused. Once the patient gets orders from, as a child, get orders fluoride, dental care, those are fillings and root canals. and the medical doctor tries to save them, and we all get blamed as the cause of the death. So I'm just questioning, what about murder by dentist? There is a dental death threat. Tom Stone, he's a psychiatrist. He was at the dental conference with me, and he goes, I know you dentists are killing my patients. I just want to find out how you're doing it. There was Dr. Cook's book, Rescued by My Dentist. So here's a murder by dentist, and for you, you're trying to be as a rescued by biological dentist, right? So what are some of the risk factors why we get sick? You all know about nutrition and diet. Typical American consume 150 to 180 pounds of sugar, mostly in fructose. Vaccination, insecticides, preservatives, all those medications, chemical stress, surgical scars. Our main topic will be on parasite and hidden dental problems. We see more and more new infections and toxins, psychological stress, heavy metal pollution, acidosis, electromagnetic field, allergy problems, and miasmatic, constitutional, genetic tendencies. Now, to understand why we get sick, we need to understand acupuncture, biocybernetics, and energy medicine to cure the incurable by measuring the what I call invisible energy field, which had been described 60 years ago by Dr. Volk, called electroacupuncture, according to Dr. Volk. I don't like to call it EAV because of the medical legal problem with FDA. I like to call it acupuncture meridian assessment, stands for AMA. If you get my joke, yeah. So acupuncture has been mapped out thousands of years ago. There's another who drew this a human energy field, but somebody mapped this energy field. Just give you one example here. This is gallbladder meridian. So I'm measuring from the foot on the both toes, and depends on whether it's balanced or not, I can predict. Some of them may have a foot problem, knee problem, sciatic hip problem, low back stiffness, indigestion, nausea, the stomach problems, heaviness in the chest, neck pain, and headache, wrap the brain around because of cognitive problems, concentration problem, migraine headaches, then cause of ringing in the ear, or it can cause of eye problems, the vision problem. Just one meridian can predict all those problems. So Dr. Vol developed this electroacupuncture. According to Dr. Vol, I like to call it AMA. So we're going to start with a case study. There's a 58-year-old man with the initial symptom of left leg pain and low back pain came to initially in August of 2009, and I saw him in November of 2009. CT of the abdomen pelvis showing 11.3 centimeter by 4.3 centimeter mass, multiloculated solid and cystic mass to proximal femur, osseous pattern, lytic, consistent with advanced disease with subcutaneous edema within the left eye, metastatic disease to the L4 and T9 vertebral body. You can now read the biopsy. Basically it says moderately to poorly differentiated non-small cell carcinoma of left femur of the bone. And this is his PET scan. So left femur here, L4, T9. There's a huge mass down there. A CT scan showing they have to put the pin because you're about to be fractured. And there's a huge edema of the thigh. When I saw him, he was in a wheelchair with a significant pain while he's on narcotics. And this is what I do for all my patients. I check 40 acupuncture points, or sometimes I check 54 acupuncture points, depends on which equipment I use. Here it says right hand, right foot, left foot, 10 points each. The scale is 0 to 100. 50 is considered of ideally balanced, and normal range from 45 to 55. And what we are measuring is the skin resistivity in ohms. Actual scale is 0 to 600,000 ohms, and 95,000 ohms is considered 50 as perfectly balanced. Green means within normal range. Blue means chronic degenerative conditions, been there for many months or many years. Red means it's a recent inflammatory process. So it's got 23 out of 40 meridians are out of balance. And I can predict by looking at it, he's got dental problems, he's got lung problems, large intestinal problems, he's got allergy problems, and he's got triple warm with the hormonal problems. If you look at the food, he's got gallbladder meridian showing up, he's got liver problems, he's got stomach meridian showing up. All those I can pick up right away within few minutes. That has been known for thousands of years of the meridian system, but how to measure it has been known for only about 60 years, and I've been doing this for about 20 years. So he had a cancer of unknown primary source and placed him in his left leg and started chemotherapy and developed severe ulceration, chemo stopped, and sent him home under hospice care. 23 out of 40 meridians are out of balance. And based on the meridians and based on what we call harmonic bioresonance phenomenon to balance the meridians, I picked ivermectin 12 milligrams 4 times a day for 10 days, and then levamisole 50 milligrams QID for 10 days. They're all parasite medication at the keto cycle. And when I saw him in January on his third visit, look at his change from 23 out of 40 meridians out of balance, now only 3 out of 40. There's a dental problem. Here's a dental problem. He's got some allergy problem. And he said his swelling was almost gone in about 6 weeks. Feeling much better. Pain is better. Lost 20 pounds of tumor and fluid. I don't know what happen every case, but I'm just telling you what is possible. In March, he was able to actually taking a vacation in Miami Beach or Florida somewhere, and he was able to ambulate. And in May, he was able to attend his daughter's wedding. And in May, he saw orthopedic surgeon, and the X-ray of the left femur completely healed, tumor disappeared, and no sign of cancer. Patient is feeling well, ambulating, and agreed to complete the dental work and GMPS chelation therapy for lead and mercury, which I found high in lead and mercury. And all my patients, I do infrared thermal imaging. If you look at from here, this is a hot spot. He's got dental problem right there. He's got some thyroid problem there. He's got mild sinus problem, but that's the hot spot. Give you a clue right away. I need to pay attention to the dental problem, but also pick up on measuring this meridian system. Most difficult patients and cancer patients, I do GMPS provocation tests. They're high in lead, high in mercury, high in platinum from chemotherapy. Also, they're very high in tungsten. They all create a condition to suppress the immune system for cancer to grow. For my patient, I do hair mineral analysis, and I always look for calcium, magnesium, sodium, potassium levels. This is a 6-month difference. You may not notice it, but the subtle difference in your sodium and potassium level from beginning to the 6 months later, I know patient is going in the right direction. Remember Dr. Haley talked about sodium, potassium, ATPase, and how the mercury affects the sodium, potassium, ATPase. I found hair analysis, sodium, potassium level, and the ratio is one of the best predictors of how my patient is doing in the long term. We'll get back to the sodium, potassium concept later on. Well, so he's doing very well, and then what happened was he had a recurrent metastasis. He's got a mass in his right arm. If you look at from there, right there, he's got big lump. And I hadn't seen him for almost a year. Last time I saw was in May, and he came back with a new mass in his right arm. When I check again, he's got large intestine showing up, dental problems showing up, and stomach meridian showing up. I told him to get a dental work to be done, but he didn't get it done. And here's a large intestinal meridian. And if you look at this chart here, this is actually large intestinal meridian. I'm measuring from his right index finger, but follow the line. It can affect your wrist, elbow, right there. That's what the mass is. And we'll go through the dental and go to the nasal sinus. So I know what the problem is. And we did a repeat thermal imaging. He's got more problem in his left side of the dental problem actually showing up there. There's a protrusion of the mass in his right arm there. So cream on, This time I did him on ivermectin, levamisole, a linear triple parasite medication, wormwood, oregano oil, Talman is a homeopathic parasite medication. I told him you need to get a dental work to be done. And because for the initial triple parasite medication, his reading looks much better. But he never got the dental work done. Because I keep telling him, you have to get the dental work done if you're going to have a chance to beat this cancer. And his response was, I'm paying over $2,000 on medical insurance, and I just don't have any money to see a dentist. I don't have any money to go through all the nutritional program, articulation therapy to get the lead and mercury out. And eventually he ended up having a recurrent tumor, metastasis to all the bone, and ended up dying because he couldn't get out of the bed, he couldn't even be able to see me. So hard to convince most patients to get the dental work to be done. And if you look at all cancer patients, we need to always thinking about parasites, dental problems, heavy metals, and what I call unresolved emotions. For every cancer I've seen, lung cancer, colon cancer, kidney, breast cancer, pancreatic, liver cancer, cholangiocarcinoma, prostate, ovarian cancer, they all have dental problem and parasite problem, heavy metals, and some form of unresolved emotions. So let me give you a second case. It's a 5-year-old boy with nephritic syndrome. First I saw him in February of this year with nephritic syndrome and diagnosed in January of 2012. The only significant history is he was falling down, hit his face and the tooth in December of 2011. Evaluated by medical doctors and dentists. Initial evaluation was perfectly normal x-ray, normal dental x-ray. The symptoms, abdominal bloating, puffy, extremely weak, heavy protein in the urine. And when I saw him in February, he got so much steroid with the prednisone, he said like a chipmunk because of the steroid effect. The acupuncture meridian assessment shows dental and kidney was out of balance. So in his meridian testing, here's a dental, here's the allergy problem showing up, and also kidney point showing up. They kind of match his problems and with the meridian testing. And basically, I send him back to the dentist. I think it's one of the biological dentists somewhere in Midwest. Repeat the dental x-ray, see if there's any change. And there's a slight change in the x-ray, and they pull the tooth, and actually they end up pulling the 6th tooth, and about 4 of them are what he described as a black tooth, with the teeth all black, and the other one is sort of a gray-black tooth. Once he pulled the tooth, all his nephrotic syndrome went away. I think we talk about, Dr. Boyd Haley talking about the mercury and the kidney problem, the small children. In this case, this is a classic from the falling down, creating the infections. So if he didn't get the nephrotic syndrome and he get another vaccination, it would tip him over. There are many other underlying problems. And then after dental work is done, all his meridians all balanced up. I didn't do anything except send to the dentist. So we have to look at unsuspected dental medical complex problems. You all know amalgams, root canals, galvanic currents, cavitation, TMJ, implants, heavy metals, bonding materials, metal allergies, composite materials, high-speed rail, biological dentistry. Dental is how do you define biological dentistry, proprioception, pleomorphism of bacteria and protozoa as a parasite. But I just want to mention about parasite and paroxysm. I learned this from actually my patient, the Mexican woman with the children. In Mexico, what they say is, if your children have a paroxysm grinding their teeth, the Mexican pediatrician will put them on parasite medication automatically. So when you have a paroxysm with a parasite, if they don't know, they're not feeling well, they're kind of clenching their teeth. What's going to happen to amalgam? They're going to grinding there at a much faster rate. They're going to destroy all those bonding materials. Composite material may not last. Cavitation may not heal properly when you have a clenching or the muscles tighten up. The blood flow doesn't go in. Or why you want the cavitation doesn't heal. TMJ, it doesn't heal. Implants may not last. All those proprioception problems, all associated simply from overlooked parasite problem and bruxism. So my message to you is, if a patient does not respond, it's either TMJ or cavitations or whatever your problem, dental problem is, you have to think about maybe there's something else, possibly parasite problem and bruxism may exaggerating your problem. So you know about the whole concept of the homotoxicology developed by Dr. Hans Ragwig. So when you have a dental infection, they get antibiotics and then eventually get a root canal, and maybe 10 years later develop prostate cancer. Or maybe have a root canal, and if it's a female, may develop breast cancer 10 years later. And they don't see that connection between what we have done with the dental and many years down the road. And while you're going through this from the what called excretion phase, reaction phase, deposition phase, there's what called normal physiological response to now impregnation phase, degeneration phase, and neoplasm phase. We are accelerating the whole process of aging process. And I just learned that our oxytocin level is also going down too. So you can maybe give an oxytocin, but it doesn't correct the underlying problem. So now we have concept of matrix regulation developed by Dr. Kissinger, talking about concept of biological brain. Here's our cells make about 10 trillion cells. And here's this capillary that supplies the blood to the oxygen to the cells, but there's no direct connection. And there's a what we call ground substance making what we call connective tissue. And this proteoglycan and glycoprotein function as what we call a liquid crystal. They can transmit information almost instantaneously. So people who does acupuncture understand they can put a needle in their toes, have an instantaneous effect in their hair. And Dr. Brownstein talks about the blood thyroid function. The level doesn't truly reflect what's going at the cellular level because there's a toxicity developed in our environment, there's a conversion process, there's what called functional hypothyroidism, even though you may have plenty of thyroid hormones. So the whole concept and biological brain is very important for you to understand. And this is a slide I borrowed from Professor Boyd Haley. I'm not sure if Dr. Haley is here or not, but this is a slide I saw about 20 years ago in West Coast in an environmental medicine conference. And here's a partial list of nucleotide binding proteins inhibited by mercury. And there's a called inhibition concentration at 50. Look at all those nucleotides for ATP, all those enzymes, and the sodium, potassium, ATPase is the most sensitive to mercury compared to all those other enzymes. So when we have exposed to mercury, first thing that shut our system down is actually the sodium potassium pump. When the sodium potassium pump shuts down, our electric potential drops. We are going to what we call anaerobic state. And one of the most common complaints is fatigue. But many years down the road, they have an increase in instead of developing cancer and chronic disease. I'm sure most of you know, familiar with this tooth organ meridian chart developed by Dr. Fritz Kramer from Germany. And if you are interested, you can download this from my website also too. Each tooth is connected with a part of our organ system. This is what we call $1 million chart for dentists who really understand the relationship with the dental and the organ system. If you understand that, you can cure so many people, what we call incurable patients. So here's a hand, here's a lymphatic system. This is a dental point right here. That's a lung meridian, large intestine meridian, nervous system, circulation, allergy point, the cellular degeneration point, triple warmer that controls the hormones, heart and small intestinal meridians. They're all mapped out for you. It's been known for thousands of years. Except some of them are actually called European acupuncture points. That's been developed much later. There's a foot. So if you look here from here, there's a heart and small intestine organ connections. I'm picking up from these, your pinky fingers. It's on your wisdom tooth. And if I pick up dental problem right there, and the heart meridian from the pinky in the heart and small intestine, 90% I'm confident that patient have a cavitation problem in the wisdom tooth area. Now, usually send to oral surgeon right away. And large intestinal meridian, the tooth 4, 5, 12, 13, 18, 19, 20, 31. I'm picking up from the index fingers there. Gallbladder meridians. Here's from stomach meridians affecting the tooth 2, 3, 4, 14, 15, 20, 21, 28, 29. Kidney meridians also in the front. The kid who fell down ended up losing 6 of the tooth, and his kidney function came back to normal. A lot of people who have the root canal in front many years later develop prostate cancer or maybe some kind of female problem. And these are all interconnected. There's a bladder meridian. So that's the concept of the meridian connection between the tooth and the rest of the body. And we have to understand the concept of pleomorphism. Antoine Duchamp talks about microzyme. Gunther Underline from Germany talks about endobiome. Gaston Nissen talks about chromatic. They're all, what they're saying is, depends on environmental conditions, cell will mutate and they will change the shape into a different life cycle. This is a microorganism called C.S. Perrier. We have 22 different independent life forms from a single cell into multicellular developing biofilm and to many different forms of a life cycle either in the water or in these sediments. The whole concept of a pleomorphism is happening in our body, in our tooth. And when you look at the dark field for all chronic disease, we'll tend to see red blood cells clump together, a lot of fibrins. This is one of the hallmarks of a chronic disease that we see these hypocoagulable state. And I'll give you another case here. There's a 50-year-old white female with a history of asthma since she was about 46 years old. And I tried every known asthma medication and for natural remedies, and I could not help her asthma. Now this is what we're talking about 20 years ago, just beginning to understand the dental, the rest of the connections. And she goes in and out of the hospital many, many times. And one time at the hospital, I said, I've been just reading about this dental how it get connected with the rest of the body. And have you had any dental work done before you develop asthma? And she said, when I was 45 years old, I had root canal, number 30. And then 6 months later, I developed this asthma when I was about 46 years old. And I told them, why don't you remove their root canal and see what happens? The patient's expression to looking at you, what? I have asthma and pulling the root canal? She never took my advice seriously, and I didn't have enough experience or talent to remove the tooth. But after about a year at the hospital, she decided to remove the tooth. I sent to the dentist, and they said, X-ray looks fine, but I knew that dentist very well. And when they pulled the tooth, he said he was a foul-smelling tooth coming out. But X-ray did not show. It looked perfectly normal X-ray. And once the tooth came out, he had to put on antibiotic for about 3 months, and then asthma finally went away. So asthma and dental can be connected. And just talk about what is possible. So we have more cases of asthma and bronchiectasis. I have a 65-year-old female from Iowa with 35-year history of asthma, responded to 2 rounds of a parasite medication. 39-year-old female from Kansas City with atypical asthma from parasite medication, and she said she actually coughed up the actual dead parasite, and then her asthma went away. 55-year-old male from Illinois with a frequent pneumonia and bronchiectasis from multiple parasite medications, and bronchiectasis went away. So one case I was talking about the dental, it's many numerous cases actually the more of a parasite problem. And people always ask, so how did you get into parasite? Did you get any special training? And I didn't. Except I was in the U.S. Army for 25 years. And year 2001, I was in Oruro, Bolivia, for part of the what we call peacekeeping mission. There's a lot of protests against American policies because we're trying to eradicate coca plants. And we went there to please the crowd. And I was a lieutenant colonel at that time. We have Lieutenant Colonel McCune. We have some of we have a nurse practitioner. We have some of the Bolivian medical teams. We did have a vet. And we have actually dentists with our group. And everybody got parasite medication. We saw about 10,000 people. They got either mebendazole or parental palmate. That's the only experience I had. I never had any formal training in parasitology at all. But after I came back from Bolivia, I said, why not try some of those parasite medications I used for 10,000 people? I know how to do EAV testing. And when I started using parasite medication, I realized that all I was trying to do was just balance the large intestinal meridian. And all of the people with pneumonia and asthma patients get better. And some of the patients with brain lesion disappears, and tumor disappears, chronic fatigue, fibromyalgia disappears. It didn't make any sense at all. But so I was experimenting with a different parasite medication thanks to U.S. Army. So why parasite problems are overlooked? We assume parasites are only in third world countries. I see in every continent, probably here in the United States, and most of them have a parasite problem, and most of you probably have a parasite problem. The worldwide global migration and changing their diet, global climate changes. After I began to study about this experiment with the parasite issues, I started going to parasite conference to learn more from actually true parasitologists. And what they're talking about is with the global climate change, now they're seeing schistosoma in northern lake in Wisconsin. That what you expect to see in India, China, and Middle East, now you see in northern lake in Wisconsin. Stool analysis for parasites is simply not reliable. Most parasites are outside of intestinal tract. They are in the brain, they are in your heart, they are in your pancreas, they are in everywhere. Co-factors from environmental pollution and poor minerals and nutritional status make you more vulnerable to parasite problem and infections. So think about just from mercury, so we can talk about as a dental group, the mercury. Mercury, Dr. Boyd Henry talked about liquid junction. Mercury or parasites to get into penetrate into your system. Animals, dog, cats, and other pets at home. Parasites have a complex life cycle and ecosystem. Parasites are disruptive, adaptive, and difficult to eradicate. They're like some of your children. You cannot get rid of them. You may have some of those children, So parasites truly have a clear market, complex life cycle, and community of ecosystem. The different life cycles on three. And this is from science, and he talks about parasites need bacteria to hatch. The communal ecosystem. It's kind of interesting that they need also bacteria to hatch the eggs. So what are the multiple signs of parasites? Parasites speak many languages as a signs and symptoms. Gas, bloating, grinding teeth, coughing at night, weight loss, weight gain, obesity, underweight, fatigue, sexual dysfunction, migraine headache, vision problems, brain fog, craving for food, eosinophilia, anemia, bruxism, allergy, suppressed allergies, immune deficiency syndrome, mental behavioral problem. I'm beginning to see more and more autistic children. They're not responding to chelation therapy and nutrition. They realize it may be something to do with a parasite problem. Constipation, diarrhea, psoriasis, all kinds of skin eczema, food allergy problems, knee pain, hip pain, abdominal pain, IBS, colitis, waking up at night, bedwetting, night sweat, night terror, nightmare, rectal itching, muscle joint pain, and cysts. Whenever you see cysts, thinking about parasite problem, your body is trying to isolate, and the tumor. I wrote many articles. You can look into my website called Parasite and Allergies, Paradise Lost in a Parallel Universe, Parasite Down Under, about my experience in Australia, parasite and inflammation, parasite and mental illness, parasite and mind control, leaky gut, leaky brain. When you talk about mental illness, mind control, leaky gut, leaky brain, we're talking about behavioral problems. I don't have enough experience right now, but I'm seeing more and more autistic children who do not respond to nutrition and chelation therapy. Parasites follow money. Parasites speak many languages, and parasites guide on UFO and FUO. The FUO stands for fever of unknown origin, and I was comparing with the UFO, comparing these, just playing with the words, but many what we call FUO is actually from parasite problem. So parasites follow money. When you cannot figure out what's going on, then there's one doctor after another doctor after doctor, and they spend money after money and money. And missing link, parasite problem, and the dental care. So we talk about oxidative stress, inflammation, we talk about the cause of chronic disease caused by inflammation. When you talk about inflammation, you talk about chronic infections. Number one source from the dental, and the gut is the primary source that we're looking for, from fungus, bacteria, virus, and parasites. Environmental toxins for heavy metals, endotoxins, allergens of food, mold, airborne, and chemicals, diet from sugar with the insulin dysregulations, and hydrogenated oil and rancid oil, diet from starvation, overeating or extreme diet, obesity, stress, overexercise, or lack of exercise, or cause of inflammation, and the medication, chemo, radiation, smoking, boxing, they're all causing what we call chronic inflammation. And this is a brand new article came out from Cleveland Clinic talking about your innate immune system in monogenic autoinflammatory syndrome. And what they're, I don't know if it's easy to see, this is what we call the nuclear cell responding to the environmental signals for inflammation. And there is called NF, it's called nuclear factor kappa beta peptide. That's one of the most primitive peptide molecules who respond to your environmental stress. And then they go to the nuclear cell and produce what called cytokine. And the company, the pharmaceutical companies are now looking at at the end of the product to control these cytokine products. But some of the people are now looking into this, control this nuclear factor kappa beta with the nutritional support. I've been just reading just enough about it. I just want to share information. I don't know enough information about it. But one of the products they're talking about is isolate from actually tobacco. That's one of the reasons maybe people are craving for maybe one of the addiction is that they're looking for that within the tobacco product they can control nuclear factor kappa beta. They will stop that chronic inflammation process. So we have a diet and nutrition. One half of what we eat keeps us alive. The other half of what we eat keeps the doctors alive. And it's so true, right? And it's your choice which you have to eat, you know. Here's one of my patients. Jeff used to look like this and turn it like this. First time he got sick, I helped him. Second time he got sick, I couldn't help him. And he went to see this raw food guru in California. And he transformed from this to that in approximately 4 months. Drinking raw milk, raw beef, raw chicken, raw food of everything, transform his body from this to that. Just the importance of the diet. And then we have this, what we call American David, and there's a biblical David, living in America. So let's compare this study here. We all know this American David is 100 or 150 pounds overweight. He's got diabetes, hypertension, erectile dysfunction, low in oxytocin, and whatever, right? He's got diabetes, angina, and arthritis. And people understand that. And he understands that. He takes insulin, he takes arthritic medication, he gets this hypertensive medication. He can live to 75 to 80 years old without modern medicine, the wonder of our modern medicine. But what about this biblical babe living in America? He's physically fit. He exercises 2 hours a day. He does a lot of sports. He has some injuries. He does maybe a couple of root canals and implants because of the sports injuries. He doesn't eat McDonald's, but he eats sushi. And he lives in the same toxic environment in America. And then what happened is, you expect he'll live 120 years old. And if he's lucky, he'll live 75, 80 years old. But this physical babe living in America will appear physically fit, end up developing brain tumor, lymphoma, pancreatic cancer, ALS, all those neurologic problems. Because he's got maybe root canals, implants, eating sushi, parasite problems, or whatever. But he doesn't have any fat to protect him. So give you an example. I have 2 sisters, looks like this. One is physically fit, one is like a 300-pound big blob. Now who got sick? One who physically appears sick got leukemia. And if you go back to the history, they live in an environment where the orchard, where they have a pesticides, insecticides, they grow apples and whatever, all those peaches, they use all kinds of chemicals. Their mother developed leukemia, and the normal-looking weight patient developed leukemia. But her sister, who looked like this, didn't get cancer. So there must be some biological role of having fat. So don't underestimate the power of these fat people. Don't laugh at them. You never know what's going to happen to you. And we talked about GMO, the Monsanto from St. Louis. We don't know what's going to happen. The biological effects 10 years, 50 years down the road. So let me give you another case. Florence from Chicago came with a squamous cell carcinoma of the tongue diagnosed in December of 1997. Instead of post-resection of the tongue, recurrent squamous cell, recommend radiation therapy. If you don't correct the underlying problem, cancer will always come back. The multiple amalgams, and that's just thyroid problems. And only thing I did on her was to remove the amalgams by dentists in Chicago, gave her some homeopathic remedies, and the tumor disappeared within 1 month. They removed the amalgam one side, and 1 month later they removed the other side. Before they go to the other side, actually tumor disappeared. So it must be what we call galvanic current effect that makes tumor to grow. And she's been cancer-free for 8 years, and she ended up dying natural age about 96 years old. There's another case. Karen, 50-year-old nurse, MS-like symptoms in 1999, dragging her left foot, weakness, electrical vibration sensations to the leg, body will jerk with a sharp shooting pain. MRI, lumbar, all fine, and neurologist say, come back next year, you have all the signs of MS, but by next year you probably will be diagnosed with MS. She got chronic fatigue, fibromyalgia, thyroiditis, several radioactive iodine therapy, UTI on ciprofloxacin and diflucan. On physical exam, she got 9 amalgams, multiple crowns and own layers, high galvanic current of 131 millivolts with 7.3 microamperes. Most of you, I'm sure you've measured electrical current running through it. Normal should not be more than 10 millivolts and more than less than 1 microamperage. And the highest reading I saw was about 400 millivolts and 20 microamperage, and that patient developed MS within 1 year later. Anyway, so we removed half of these amalgams. No, I'm sorry, she's the other lady. I told her to see a dentist. And all my patients, I do hair analysis, look for heavy metals, all those cleansing, digest enzymes, zone diet, blood type diet, and her mercury level was very high, the baseline and the after, from the baseline of like a 3.7 to 73 after using chelating agent. And 2 years later, she got partial dental work done. That really always bothered me. She knows, and her husband is a pharmacist, and she only gets a partial dental work done. I told her, get the dental work done. but she only going to do only what the insurance will pay for it. She only did like a 3/3 of the dental work in 2 years. But her neurologic symptoms almost resolved, except when she used fatigue, lost 40 pounds on a zone diet, blood type diet. Feeling better, chronic fatigue, fibromyalgia resolved. Her husband said he got his wife back, and I saw actually 4 times. Most of them need to go to get the dental work done. There's another case with MS, 27-year-old white female with a newly diagnosed MS with brain lesions. I'm just seeing the meridian system, and 1 year later, when they did a follow-up MRI, they say the lesion disappeared. They say, you don't have MS anymore. And then there's a 39-year-old American-Mexican man with 12 amalgams and newly diagnosed MS. Vision problems, the weakness of his legs, MRI consistent with MS. He actually had an appointment to see biological dentist with the 12 amalgams that they knew about the amalgam. And I told the patient, before you go see a dentist, let me take care of your gut first. Because you got a lot of GI problem according to meridian system. Put him on 2 different kinds of parasite medications. And 6 weeks later, so another neurologist for second opinion. And he looked pretty good. So the neurologist had another MRI done to make sure he's got MS. And during that 6-week period, the brain lesion disappeared. So, as a dentist, you know about the importance of the amalgam. That's half of the story. Parasite might be the other half of the story. And the problem was, once his MS symptoms disappeared, and then I told him, now you need to see a dentist. Now he doesn't want to spend $15,000. So he was delaying it. And I couldn't convince him until 2 years later. His neurologic symptoms are coming back. That by the time he's got actual symptoms coming back again. So just give you an idea how to difficult to convince him. So modern medical and dental treatment almost never deals with the reasons why these problems exist, why they frequently create new medical problems as side effects of the treatment. We must address the underlying problems. We must think differently. So these are some of the medications I use for parasites based on acupuncture meridian assessment, all the list of the medications. And this is one case study from Cleveland Clinic. He's a 55-year-old man with congestive heart failure and cardiomyopathy. And he ended up dying, and they did the autopsy. And what they found was a strongyloid in a lung biopsy. So it was a parasite causing congestive heart failure and cardiomyopathy. And it says strongyloid larvae may persist in the body for 40 to 50 years. Once they're in your body, they stay with you for the rest of your life, just like your children. And they said, how does strongyloid get transmitted? And so it can be from inhalation of infected eggs. It can be actually from the air. So we need dentistry, needs partnership with dental medical doctors who understand energy medicine. We have to have this partnership. I know dental is important, but you have to think about the rest of the body. And that'll make your dentist last longer, have a more effective if you can think of the rest of the body. Just like to remind you again about unsuspected dental medical complex problems, how these parasites and broxins can mess all your dental up down. Some of the controversial ideas and new ideas in biological dentistry. I know you know much of very well aware of the cavitation, nickel and cavitate. Some of the concern about the false positive and false negative studies. Ozone therapy may not be independent. You may have to work together with the oral surgeon to clean out and using ozone therapy. High-speed drill. I'm sure you're aware of the danger of the high-speed drill. We talked about neuromuscular cranial dentistry with the bite and like a tongue, position of the tongue, laser dentistry, implants. I took like a little touch on Lyme, autism, PDD, and autism, like a, what is it, the autism, what do you call it? ASD. The what? Yeah, autism spectrum disorder, I'm sorry. Because I don't see too many autism children, but I'm seeing more and more. But a lot of these are actually might be hidden dental trauma may play an important role, especially what we call Lyme kids. many of our Lyme cases not really Lyme. There's a hidden dental problem from root canals and cavitation problem, the spiral tooth infection, and they have a mimic exactly like what we call Lyme disease. And I'd just like to point out also bioenergetic medicine in dentistry. We've been talking about biomechanical, biochemistry, biochemical toxicology, but we have to understand biophysics and energetic relationship in dentistry. I know Dr. Cook is in the back somewhere. He's one of the few dentists. He's 82 years old and one of the pioneers in concept of bioenergetic medicine in dentistry to pick up hidden problems that nobody can by understanding energetic relationships. And I just want to add on, when you talk about dentistry, please thinking about the parasite. When your dental care does not last very long, you have to think of, is the patient possibly have a parasite problem? This is just give you an idea of the cavitate, or the considered parasites. To get a cavitation, what can be done, but just what I call is the first narrative study. First parasites. The patient doesn't have any symptoms at all. How do you differentiate if it's truly cavitation or not? There's no other way to do it except energetic testing. That's the only way we can detect whether it's a muscle test or acupuncture meridian testing. It's a 60-year-old female with a blood pressure of 250 over 150. When I checked, all 40 out of 40 looks okay, except one meridian was showing up, and it was a dental meridian showing up. And when I sent to the oral surgeon, the whole area that is drawn by the oral surgeon is actually whole cavitation area. Once you get the dental work was done and cleaned out the cavitation, her blood pressure came down to 130 over 80. Just from the dental work. So we're talking about learning how to use parasite medication and dental care for anti-aging. One of my patients raised horse, and she said the horse their life expectancy used to be about 15 to 20 years. Now with the routine dental care, and routinely they do deworming at least twice a year, up to 4 times a year, if it's a racing horse, and they can expand their lifespan from easily 35 to 40 years. They're doubling the lifespan by proper routine dental care and routine deworming process. So I can do one part, which is a parasite cleansing, but you have to do the other part, which is a dental care. Now, this is what called asymmetric thread. I do give a separate lecture on actually cancer, and I use a lot of military analogy, and thinking about asymmetric thread coming from parasite and dental. This is famous Donald Rumsfeld's quote. There's a known knowns, known unknowns, and there's called unknown unknowns. The parasite is like a known unknown. We know parasite is there, but we don't know the degree of the implications. We know dental problem is known, but we don't know the degree of that medical problem. So when you combine parasite and dental, it becomes unknown unknown. It becomes impossible to think of unless you know both of them. So here's my book, Accidental Cure, and one of the biological dentists pointed out to me, is that funny? Isn't it funny? Accidental. Isn't it accidental? Did you know that? I said, I don't know, but that's a good idea. So rather than doing accidental prone dentistry, now you can do accidental cure dentistry, and we can do accidental cure for cancer by understanding dental as an important part of your medical care. So the science deals with the relative truth. There's a science, and then there is what's called statistics, and we have scientific fiction, and then we have a scientific authority, we have a scientific dogma, and we do have scientific dictatorship. That's what we are up against. And now this is what we fight the system. And I thought Boyd Haley quote very well. Here's I just put a new slide. The American philosopher Boyd Haley. Don't underestimate the power of certain people from FDA, ADA, AMA, and whatever. You can figure out. That's the end of my talk. Okay? Thank you.
you, Dr. Yu.
Thank you.